Continue our look at today's Healthcare Summit. We want to welcome Representative Diana DeGette from Colorado's 1st Congressional District. Democrat, thanks for being with us.
Good to be here again.
What will come out of today's summit?
Well, I hope that there's some good talks between both sides about if there's any common ground we can find on healthcare reform between the Democrats and the Republicans.
One of the sentiments that has been coming up from members of Congress, Democrats and Republicans, is expressed in this Twitter comment saying that the summit is indeed a setup. We need to stop talking about medical care reform and start fixing the economy.
Well, there's two things we need to talk about. We need to talk about we need to talk about insurance reform. We need to talk about how we can get 37 or 40 million people who currently don't have health insurance into insurance plans. And the reason is we can't fix our economy until people have health insurance. And so if we want to sort of limp along with medical costs becoming an increasing percentage of our gross domestic product, then we won't fix health insurance. But if we really want to get everybody into a health insurance program, which number one will improve their health, but number two will also create more efficiencies in the system, that's going to help our economy.
Some have suggested you can eliminate the conference committee process, the House can approve the Senate bill, goes to the President's desk. What is in the Senate bill the Democrats don't like?
Well, there are a lot of things in the Senate bill that a lot of members of the House don't like. The first thing they don't like is the way the Senate pays for their bill by taxing what are called high-cost plans. And in the media, we've seen a lot of people say, well, these are union plans. But in fact, some of them are union plans. Some of them are just plans that people going out onto the open insurance market are having to buy with their own money. In my committee yesterday, the Oversight Committee of the Energy and Commerce Committee, we had some hearings about the fact Anthem Blue Cross in California is raising its rates for those folks, for people on the private insurance market, 39%. In Colorado, my state, 20%. So the way the Senate pays for their bill is to tax those plans, and we have a problem with that because those are middle-income folks who can't afford to do it. There are other problems that a lot of House members have with the Senate plan as well. One of the problems I have is, as the co-chair of the pro-choice caucus, I'm concerned because there were anti-choice provisions in the House bill that went through, but there are also provisions in the Senate bill that we believe might restrict the availability of a full range of women's reproductive choice. We can't fix that by just passing the Senate bill. And so there have been a lot of discussions in the House, in the Senate, and with the White House about how we could sort of take the House bill that we passed, take the Senate bill, and then work to try to find some common ground with those two bills. And frankly, if the Republicans would really sit down and get serious about finding some common ground where we could get insurance coverage for a large number of people, that would be the optimal situation.
There's an email from a viewer saying, I now pay more in health insurance premiums than anything else but my mortgage. We
Yes.
must have a single payer.
Well, I myself would support a single payer system, but I don't think that, well, I can tell you definitively we couldn't pass that. And my opinion is we can't sit around for 20 more years in hopes of finding the perfect when in the meantime we can find the good. If we have some kind of insurance exchange that is a robust national insurance exchange where people can go and buy insurance policies and insurance companies have to compete for that business, we think for folks like the email writer and others, their insurance costs will go down. So I think that a good competitive system is really going to be key. One other bill that we passed just yesterday in the House, it's a start. What it says is we are going to remove the antitrust exemption that health insurance companies now enjoy. There's only two industries that are exempt from the antitrust laws, and that is insurance and Major League Baseball. We don't see any reason for that because if there's competition, we think people's insurance rates will go down.
You can participate a number of ways. Give us a call at 202-737-0001. That's our line for Republicans, and 202-737-0002 for Democrats. If you're an independent, 202-628-0205, or send us an email at journal@cspan.org, or you can join the conversation online at twitter.com. Facebook.com/CSPANWJ, and a lot of you already have, but Mary is joining us first on the Democrats line from Bradenton, Florida. Good morning.
Good morning. Morning. My name is Mary. I'm calling.
Yes, please go ahead,
Hi, Mary.
Oh, okay. I'm sorry. My name is Mary. I'm calling from Bradenton, Florida. I have a question and then a comment, please, if you don't mind. First of all, they say Medicare is free. I am disabled, and I've been getting Medicaid, Medicare for like 7, 8 years now, and I have to pay every year for what I have, so it's not free. And second, the Republicans kept saying that the nuclear and the reconciliation way to go to get the bill passed is the same thing. It isn't the same thing. And the Republicans keep saying that the nuclear is the same as reconciliation, and it's not, and I know it's not. So they can't fool me with that one. And when they were saying that there wasn't nobody in the room to talk about the public option, I watched the whole thing, debate of C-SPAN on TV. And the Republicans, every time they talked, they got up and left. And the Democrat was talking about the public option. They wouldn't even stay in the room to even listen to debate it.
Yeah,
They just
Mary,
want to get up there and argue.
yeah,
Thank you, Mary.
Mary, let me just comment in two ways on what you're saying. First of all, with Medicaid is a program that's administered by the states, and you're exactly right. Some Medicaid recipients around the country, varies state by state, do have to pay certain amounts, co-payments and payments for their drugs and so on. So that's going to vary state by state. But secondly, something people don't think about is with all these uninsured people in our country right now, over 40 million people, what happens is people who pay for health insurance really end up paying twice. They pay their health insurance premium, but then they pay extra because hospitals and doctors and others have to pay for uninsured people who just show up at the hospital. That's what we're trying to fix with our bill. And finally, I will say, you're exactly right when you say that we had a public process with this bill. In my committee, which is the primary policy committee of the House, Mr. Burgess, who was on before me, he's on my committee, we had days of hearings on health care reform. We had days and days of a markup on this bill. Everybody who wanted to offer an amendment was allowed to offer the amendment. Some were accepted, some were rejected. And so I don't really understand why people are complaining that we didn't have a public process, because I've been in Congress for 13 years, and this was the longest debate, the biggest public process we had.
From the New York Times, and I asked Congressman Burgess the same point, but I want to bring up a new bit of information from Mark Lubavitch this morning. He points out that Mr. Boehner on the House and Mr. Obama have not held a single one-on-one meeting since the president's election. That, according to Congressman Boehner's office. And Representative Eric Cantor, the House Republican whip, has described Mr. Obama to colleagues as, quote, thin-skinned and quick to bring up Republican criticism of him.
I don't think that it's particularly productive for people to be going back and forth calling each other names, Republicans or Democrats. And in fact, I was talking to one of my Republican colleagues yesterday about a friend of mine who I've worked with on a number of pieces of legislation about what bipartisanship really means. And what bipartisanship really means is you sit down with somebody, you try to figure out if you've got common ground that you can work on together and if there's a compromise. You can't always find a bipartisan solution, but that's part of bipartisanship, to recognize that and then move on. And so I think what happens in Washington, bipartisanship doesn't become a method for passing legislation. It becomes an end unto itself. And once that happens, then you're setting yourself up for failure.
From this viewer saying that the president will moderate, it's like a coach also being the umpire. This viewer saying this whole thing is a joke.
I hope it's not a joke. I think it's positive that people are sitting down at the White House and talking. Health care is a critical issue for millions of Americans. In this hearing that we had yesterday, we had 3 witnesses who are self-employed from California who can barely afford to pay their health insurance premiums. And all 3 of them had either themselves or a family member with a pre-existing condition And they're like the email writer a few minutes ago, they're paying almost as much in their insurance premiums as they are for their mortgages, but they can't switch insurance because they've got a pre-existing condition. And so they're pretty much stuck where they are. This is the kind of crisis that American families all around the country are feeling, and this is why we really need to stop this bickering, and we need to sit down and really figure out health care reform.
The venue, of course, for today's meeting is Blair House, and here's the agenda as released by the White House. 4 separate talking points, or talking points, if you want to call it that. Controlling costs, and that part of the summit will be introduced by the President. Insurance reforms, and that part introduced by HHS Secretary Kathleen Sebelius. Also a focus on reducing the deficit with Vice President Biden. And then back to the President as he talks about expanding health care coverage. You mentioned your hearing yesterday, one of a number of events that have been put on our website at cspan.org and the Health Care Hub. You can, of course, watch today's proceedings live online at www.cspan.org and also live on C-SPAN 3. The House and Senate will both be in session today, which is why we're putting our coverage live on C-SPAN 3, primetime coverage on this network this evening. Pat is joining us from Fort Worth, Texas, Republican line. Good morning.
Hi. I guess right now the party of no until there's another party. People do not want a chip. No chip. Hillary's failed because she wasn't a national ID. No national ID is not necessary with Medicare. It's not necessary. And people have no right to health care. The only rights we have are what come from God, and we give them to you. And we have a right to freedom of religion, which y'all care more about taking away than you do our health, frankly. And we need to depend on God. But I'm going to tell you right now, I think the single payer is better because people out here don't. I know a woman who didn't have money for a cab to the hospital, so she calls an ambulance. Okay, you people cannot get this healthcare system right when it doesn't take a rocket scientist. It just takes a few women, and not this woman here. This woman here has brought more damage to our country than any woman in Washington.
How
she
so,
was
caller?
like a mad dog trying to see that we got abortion paid for, and she talked to Republican, and she gave a Republican time, Joe Barton, to talk people into stem cell abortion. What you do is you bring the judgment of God on the country. That's why we got to have a single payer, because when they voted for abortion, the whole country froze over. What did that cost us? Then they voted to put the morning after pill in all the military hospitals to keep the women on the field in the military. What did that cost us? The whole country froze over.
We'll get a response. Thank you, Pat.
I think that people are understandably anxious about the idea of national health care reform, but what they have to realize is that every single American is paying for health care right now for poor people or for even middle-class people who can't afford health insurance. And unfortunately, they're paying for it in the very most expensive way and in a way that doesn't give good health care results to folks, because for millions of Americans, the only way they can get health care is if they go to the emergency room. And when they go to the emergency room, number one, they're already very sick, and so that's not good for them health-wise. And secondly, it costs a lot more money, and it costs money for us, the taxpayers. So that's why we think it's in the national interest to develop some kind of a system where people can actually buy health insurance policies that will be affordable. And we think in order to do that, we need to make some reforms to the health care system, but we also need to get more competition in the insurance markets.
Well, one of those reforms is what James is twittering about, saying that the era of the company man is over. He wants to know, why expect employers to administer health insurance to a transient workforce?
Well, I think James has an excellent point about the workforce being transient, but I think what we've decided to do is build on the current system rather than just throw away the system and start all over again. And the current system we have is employer-based health insurance. But what we have said in both the House and the Senate bills is insurance companies, if they're insuring somebody, can't just drop them because they switch employers. and they can't exclude them from coverage because they have a pre-existing condition. So we think those two components will help people who are moving from job to job or state to state keep their health insurance if their new job doesn't have insurance or something like that. The other thing we're doing to try to be able to help people who switch jobs get insurance is setting up this exchange that I talked about, where people could go and buy insurance policies on their own in the exchange. And if there's competition, then we think that people will be able to get cheaper insurance rates than they can now. Part of the problem we have around the country, over 80% of our insurance market has one provider. So for example, in Pueblo, Colorado, which is just south of my district, one insurance company has over 70% of that market. We don't think that that's conducive to good old American competition, and that's why we think we need to have, number one, remove the antitrust exemption, and number two, why we think we need to have some kind of competition through an insurance exchange.
The summit will get underway in about an hour and 40 minutes. It will take place at Blair House, which, for those of you familiar with Washington, D.C., is directly across from the White House, 1651 Pennsylvania Avenue, and Blair House is actually 4 row homes. The walls were taken down during the Reagan administration during an extensive rebuilding effort back in 1984-85. It reopened in 1988, and among the rooms that was renovated and built during that renovation project is this room, the garden room, which is where the summit will take place today. A rectangular table with members of Congress and members of the administration, and of course our cameras inside. You can also listen to the proceedings on C-SPAN Radio. David is joining us from Market Heights, Illinois. Good morning, David.
Yes, thank you for C-SPAN. I just had a question, if she could give a real comment on this. I'm an apostolic Christian, my family. We never go to the doctor. Our children are born at home. The only time we call anybody is for a coroner, because no vaccinations, no immunizations. We do not take any type of prescription drugs, never even had a Tylenol. I'm 31 years old. I've never been sick in my life. We have a high dose of vitamin C every day to keep from getting sick, and they've finally come out with the vitamin D now is a cure for cancer, that it's killing cancer cells in every type of animal. What about, I know I'm already paying it through taxes, but we don't want to use the healthcare system.
Representative DeGette?
Well, if you get into a car accident or if your child gets injured, then you'll be taken to the emergency room, and you will. One of the options we want to give to folks like you is to buy a low-cost insurance policy that will cover catastrophic costs. But sometimes you can't help a way that you get sick, and I'm delighted to hear that your family's so healthy. I would hope that we would be able to work on wellness programs so that every family could be that healthy. But accidents do happen, and crises do happen, and that's why everybody, I think, needs to participate to some degree. Although some people may not choose to buy as robust or detailed health insurance policies as others.
Our guest is the Chief Deputy Whip in the House of Representatives for the Democrats. She's also a member of one of the health subcommittees, part of the Energy and Commerce Committee. She represents Colorado's 1st Congressional District. Isaac is joining us from New York City. Good morning.
Good morning. Hey, how you guys doing?
Hi, Isaac.
Hey, I think you bring up some very good points. Healthcare reform is definitely necessary so that everybody in this country can get an affordable plan. However, I do have some concerns. 2 quick points I want to make. How affordable is it going to be when it's going to raise taxes, and we're already paying taxes because of the irresponsibility of bank and the Federal Reserve and Goldman Sachs in the bailout situation? And another thing is, it's one thing to make it affordable for everybody and come up with a plan, and I wish that the Democrats and Republicans can have some common ground. That's necessary. Yeah. But to have no public option with a penalty, because it's a lot of people who don't have health care because they feel fine and they don't want it. Now, yeah, we're paying taxes regardless for people who don't have it, but to force somebody and penalize them with taxing them and penalize them, okay, if you don't want health insurance and we pass this reform, we're going to penalize you. I just don't think that's the solution.
Well, Isaac, thank you for those thoughts. The first thing is we are not taxing average folks to pay for this plan. In the House version, we tax folks who make over $500,000 a year. We think that they could afford to pay a little bit more. But for average folks, for average middle-class folks, we hope, number one, there's no tax. Number two, we hope that by putting this national exchange in place where people can actually get competitive bidding for their health insurance plans, that their costs will be lowered, and so they'll actually end up paying less money. I just go back to this hearing yesterday where we had average middle class Americans who are paying 20–30% more in their insurance premiums, almost as much as their mortgages. The other thing is that it's important, if we are going to reduce the cost for folks, that everybody get the health insurance. That's why we're saying in our plan everybody has to be enrolled, because if we don't put everybody into the pool, then the people who are at the most high risk, older people, people with chronic pre-existing conditions, are just going to have to pay more and more insurance. And so everybody at least is going to have to participate at some level, but we're hoping if we do get everybody set up in health insurance and there's competitive purchasing, then that will reduce the cost for everybody.
Our guest is Representative Diana DeGette. Jeff is joining us, Republican line from Parkersburg, West Virginia. We welcome you to the program. Good morning, Jeff.
Good morning. Thank you for having me on. I have three questions for the lady, okay? One, I used to be an employer, so therefore when you say that when employees leave from company to company, the insurance won't come, each company has their own insurance company. So therefore when the employee transfers from one company to another company, they have to start the process all over. The second comment I have...
Well, Jeff, let's take it one at a time if we could.
Yeah.
Can you stay on the line?
Okay.
Sure.
Jeff, let me talk about that. You're exactly right. Each company has an insurance. And what happens right now, if an employee wants to change jobs, sometimes they can't change jobs because they have a pre-existing condition. So if they get another job with new insurance, then they're not going to be able to get insured for that pre-existing condition. We change that in our legislation. We say insurance companies cannot deny people based on a pre-existing condition. So actually, our bill is designed to be able to help people move from job to job more easily.
Your follow-up, Jeff? Jeff, you with us?
Pardon me?
Did you want to follow up?
No, ma'am. No, sir. She's absolutely correct. But what the problem is that I think that, you know, that's a good idea, but there's other stuff added on to the bills that, you know, help people with, well, say her state gets a certain percentage if she votes for it. I mean, that was shown on TV and what was talked about on C-SPAN as well as other news broadcasts companies. But the second point I want to make is I received an injury to my back. I've had 2 operations on my back. Each time I've gone to the hospital for a pre-op test, okay, for 15 minutes, they've charged my insurance company $2,500 for 15-minute work, listening to my heart, taking my blood, and asking me if I'm allergic to this, okay? And for 15 minutes. That's ridiculous.
Yeah.
Second, you know, the rest of it is, you know, I paid, my insurance is Champus. I served in this country for 6.5 years, got my hand blown up, came out and had my own insurance company with the state plus Champus, raised my family. Now I'm hurt. I had to sell my company to my son to take it over because I couldn't do the work no more. So I'm stuck with my Champus insurance.
Right. Well, I mean, what you're saying is exactly why we want to reform the insurance system, Jeff. And by the way, thank you for your service to this country. We all cherish all the service, and we know many people like you have lifetime injuries. Let me just respond to a couple of things you say. First of all, in the House bill that we passed, we did not have any of these special deals for states. And I did not seek or get any special deal for Colorado for voting for this bill. What I'm seeking in this bill is quality and affordable insurance for all Americans so they can all get good health care. And I will also say this, the House members do not intend to vote for any bill. This is one of the problems with asking us just to accept the Senate bill. We're not going to vote for any bill that gives special deals to certain states. We don't believe in that in the House, and we think that's going to be fixed. The situation that you talked about, going to the hospital and having to pay $2,500 for a 15-minute test, is exactly why we think we need health care reform. The reason why that hospital is charging you $2,500 for a 15-minute test is because while you might have insurance, the next guy doesn't have insurance. But if he shows up at the hospital with an injury, then somebody has to pay for it because the hospital has to treat that injured person. The one who ends up paying for it is you. And we think that that's unacceptable and frankly unfair to you, because you have to pay more in your insurance costs, you have to pay more in your deductibles and your co-pays. That's why we think that we need to get everybody insurance so that the hospitals aren't charging the people with insurance extra money to treat the uninsured people. So, you know, really in many ways, as I said earlier, you are paying twice. You're paying for your insurance, and then you're also paying to help cover all of the people in this country who can't afford to buy health insurance and just show up at the emergency room.
Diana DeGette represents Colorado's 1st Congressional District. Thanks as always for being gracious with your time.
Great to be here. Thanks.
Appreciate it, Congresswoman. We're going to continue with our look at today's health care summit.